school year. And I am so delighted to have two amazing panelists to talk about dyslexia, and as well, we'll learn so much of the work that they are doing in the school and as well in the community and with families. So first of all, I want to welcome Dr. Gaab, who's an associate professor of the pediatric at the Boston Children's Hospital and also a member of the Harvard Medical School. And her research within the laboratories of cognitive neuroscience focus on the brain correlate of reading development in typical and atypical children, as well as possible use functional magnetic resonant imaging, which is fMRI, which is a non-invasive brain imaging tool, as well as behavior measures, tools to study the reading brain. She's also currently working on various other research topics, including the identification of the underlying neutral mechanism of dyslexia and ADHD. In her work, Dr. Gaab collaborates with several universities in the US, such as Tufts and MIT. Her research from all over the world, including China, Brazil. She assigned major significance of the clinical translator of her research as well of the community outreach. With no further ado, it is my honor to introduce Dr. Gaab with us tonight. Dr. Gaab will be presenting about early identification and the neurobiology of dyslexia reading difficulties. And we'll take questions after our presentation. Thank you.
Thank you so much for having me tonight. Do you want me to share my screen now? Welcome, everyone. I'm going to share my screen so I can show you some of the slides I prepared for you. Okay, can everyone see my slides just to double check? Okay, great. Yeah, so what we will do today is we will give a broad overview about developmental dyslexia and other reading difficulties, and focus really on what are the important steps for learning to read, and what goes different, or what happens in children who are struggling with learning to read, and where can we see these difficulties on which levels, and how can we identify these difficulties early? So what's really important to keep in mind is that learning to read is a very difficult process. It requires a series of different stages, developmental stages, that start with language processing early on, even before the child is born, and ends with being a proficient reader many years later. What's important to keep in mind is that learning to read is not a natural process. So if you put a child in a big library and you just lock the door for a couple years, they're not, learning to read just because they're surrounded by books. It's not like language, where if you surround a child with enough, rich language, they somehow pick up the language. It's more like learning a musical instrument. So if you're listening to, let's say a piece by a famous composer like Mozart, you can listen to it many, many years, but if someone gives you a piano, you're still not able to play the same piece on the piano. What this means is that we need to actively teach a child to learn to read, and we need to teach it in the right way in order for the child to learn to read. Okay, so it's not something that just happens miraculously. So if you look at typical reading development, and so here I have a timeline, most people think that learning to read starts with maybe the first day of kindergarten, or maybe when they start preschool, or maybe when they start learning letters in their homes or associating sounds with letters. But if you really look at it from a research perspective, learning to read starts in utero. And the reason in utero prenatally it starts that early is that the first fundamental milestone for learning to read is language processing. Okay, so sound processing and language processing are really important. And for the next 4 or 5 years, this is the most important milestone for learning to read. Then around age 4, maybe 5, there are some things that are, added to this important first milestone of learning the language you want to read but also, the mother tongue. And that is called phonological processing or phonological awareness, which is the ability to manipulate the sounds of language. And I give you some examples. So you could do this fairly easily with very young children and ask them, do 2 words rhyme? If they don't know what rhyming means, is you can give them 3 words and ask them which 2 of the 3 words sound alike. Like if I give them bat, rat, house, and ask them which 2 sound alike. So if they are able to do this, that means they acquired the first steps of phonological awareness. And they can get more difficult. So you could ask them, like, say the word banana without b. And it can get very difficult where you could say the word fixed without k. So what I'm illustrating here is that there is, a need to learn, to be aware that that language is comprised of sounds, and that I can take sounds away and add sounds, and that these sounds make the words. Then when you're starting kindergarten or preschool, you are mapping the sounds of language onto the letters. We also call this grapheme phoneme mapping, which then leads to decoding or reading single words, very short words. And then the ultimate goal of learning to read is reading fluently, reading automatically, and comprehending what you read. So you understand by me giving you this timeline that there's many different ways where reading can go wrong because there's so many different milestones. It's just really important to keep in mind that if a child is struggling with learning to read, we need to identify where in the process is the child struggling with learning. Is it the language, like early on? Is it the phonological awareness, which is a very strong predictor of reading development? Is it the decoding, the mapping of the sounds onto the letters? Is it the reading longer sentences? Is it the reading fluently, or is it comprehending what I read? Okay, so it's really important that just because someone is struggling with reading doesn't mean they all should get the same intervention or the same help. It really depends on what are they struggling with. What's also really important is that there's a shift from learning to read to reading to learn, which usually in the United States is around the end of 2nd and the beginning of 3rd grade.
Yes.
What happens then is that
so technically, no, I don't know who these people are, but the people that have their hand raised, the only way to communicate with them if they type in a question, right?
Okay. Should I continue?
Yeah, no, I'm right here.
Okay, good. Okay, so it's really important that someone is reading by the time we shift from actively teaching how we read to utilizing reading as a tool in conveying knowledge. And so often kids are struggling the most after the shift is happening. So in 3rd and 4th grade. So it's really important that we detect children's struggles before that, so that then it doesn't have so much of an influence on their math homework or the word problems or social studies, etc. Okay. So if you look at this, we have a more mechanical piece here that we call the word recognition piece, and more of a language piece. And we need both parts in order to become a skilled reader. Okay, so the word recognition piece, these are primarily kids who struggle with what we call developmental dyslexia. Okay, so they are having problems with phonological awareness that I just explained to you. Decoding, so mapping the sounds and the letters, and then the recognition of sight words. But you can also struggle a lot with reading when you have problems with the language. So if you don't have the vocabulary, or if you don't understand how the end of the sentence is connected to the beginning of the sentence, that can also affect how fluently you read, or if you have problems with comprehending. Okay, so if you look at childhood reading skills, in the US, 65% of fourth graders are reading below grade level. And this can have strong implications for their self-esteem. Children who struggle with reading often feel helpless. They often show anxiety, sadness, depression, or behavioral problems, right? They often, you know, maybe start with aggression because they're so frustrated that everyone surrounding them can read, but they're struggling so much with this. So it can lead to either internalizing behaviors that the kids, you know, show, like depression or anxiety, or externalizing behaviors where they're more aggressive and more hyperactive, etc. So it's important that if you look at, you know, adult outcomes, that children with learning disabilities are less likely to complete high school, less likely to start college, and definitely make a lot less of an annual income. So it's important that we catch this early. If you look at this here, you have from 1992 to 2019, you see scores that the US has collected in terms of how well children are reading. And so this line here would be if everyone is reading what they're supposed to read. But what you see here is for the last 25 years, we have a lot less children on average that are proficient readers than, you know, the average than we should have. So we need to make some, you know, more fundamental changes. What we do know is that 70% of children who are struggling in first grade are still struggling in 8th grade. Okay, so children who have difficulties with learning to read in 3rd grade are likely to struggle throughout their entire educational career. So it's really important that we tackle this early. And if you hear like, oh, it's a boy, he's gonna catch up, or oh, he's born in the summer, or she's born in the summer, you know, she will eventually, you know, get there. And some kids mature a little slower and some a little faster. If it's dyslexia, you wanna catch it early. And with early, I mean kindergarten, you know, or even before that. So that's why we are doing a lot of research on how do we best find kids who will struggle with learning to read in kindergarten, so that they're not getting behind and are not having the problems that I explained to you earlier that come with struggling reading, the you know, depression, the like low self-esteem, the feeling like stupid, the feeling lazy. These are all go hand in hand with struggling reading, and they shouldn't, because we should find them early and intervene early. Struggling readers are 4 times more likely to drop out of school and African American and Latinx children who are struggling readers are twice as likely as their white peers drop out before high school. So it's especially important that we pay attention to all children who are struggling with reading, regardless of their, background, regardless of their cultural history, regardless of their language history. So how does reading improve or help with learning? So in kindergarten, most children who start with their little backpacks in the first day of kindergarten have a vocabulary of about 10,000 words. So that means that they know the meaning of about 10,000 words. And most of the meaning they learn from their caregivers, maybe their grandparents. The bad words usually come from their siblings. And so over the years, a fifth grader goes from 10,000 to 60,000 words. So they learn about 250 new words per week. And a lot of this is learned through reading. And it doesn't mean that the child needs to sit down and read like a big novel. It's like reading on the bus and reading on the subway and maybe reading in the doctor's office and maybe reading like in the supermarket, etc. So what happens if you are struggling? So students at the 90th percentile, what this means is that only 10% are reading better, may read as many words in 3 days outside of school as a child at the 10th percentile. So these are the children who are really struggling, reads in an entire year outside of school. So you can see how struggling with reading affects how much they read and, the knowledge about the world, their background, etc. So it has a lot of effects, not just on academics, just on how much they know in general. So what leads to atypical reading, struggling reading? So there's some genetics, there's the brain, perception and cognition, and the environment. And so we know now that not one of these factors leads to problems with reading. Usually it's a combination of all of these factors. So let's look at dyslexia. So we see this as a reading disability umbrella. And under the umbrella, you have children with dyslexia. And in the next slide, I'll show you what this means. And these children are about 7 to 10%. So if you have a classroom with, let's say, 20 children, you have one or two children usually who struggle with dyslexia. But there's also children who struggle with reading because of environmental circumstances or low language skills. So remember when I explained to you that there's these two strands that lead to skilled reading? One is more the mechanical way where I need to know how to manipulate the sounds of language and how to map the sounds of language onto the written counterparts. So this is more associated with dyslexia versus kids who are struggling with reading fluency and reading comprehension are more falling in this pink bubble here. And there are kids who have problems with both because dyslexia, if not remediated and intervened early, can have secondary consequences. However, what's really important about dyslexia is it affects about 7 to 10, 12% of children. And it's a difficulty with accurate and or fluent word reading, okay? So if the child is in first or second grade and has no problems with mapping sounds onto the letters and reading short words and maybe reading like 3-word sentences, and that would usually not be considered as dyslexia. However, because of their language background, these kids may show signs of struggling readers once you need to read more fluently or with comprehending what they read, okay? So there's a fine distinction. So if a child initially has problems with manipulating the sounds of language. So they have problems with deciding whether two words rhyme or not, or whether two words start with the same sound. So you could give them like sun and snake and house and say which two start with the same sound. And if they have problems with this, and they have problems with mapping these sounds onto the written counterparts, the letters, that would be called dyslexia. But if they can do this, but have show later problems with fluency and comprehending what they read, that would be more falling under general reading difficulty. However, all of these kids need help. Okay, so that's why it's so confusing. And so it's really important that, you know, we make sure that we understand where exactly is the child is struggling and where exactly do we need to work with this child. So if you look at this, you can see an adult reading a couple of words. And what's really striking is there's a lot of different brain areas that are involved in reading. Okay, so it starts here in the back of the brain. So this is the brain seen here from the left side, like you're looking onto my left side. And there's like visual areas, and there's a lot of language areas, and then there's also areas that we call the CEO of the brain, so higher order like language areas that help with integrating what you read in a bigger picture, background knowledge, comprehension. And you can see that it requires a lot of different brain areas to work together in order to read just a couple of words. So if you look in dyslexia, and here again you have brains, and we look from the left side, we have children, we can see that children are struggling with several components of what we call a reading network, okay? So we have like an area that really recognizes letters. We have areas that are important for language processing and for mapping the language onto the written counterparts. And so we have a lot of like interaction between these language areas and these, what we call it the letter box in the brain early on. Here, this like magical triangle. And then eventually, once the child gets a little bit better with reading and reads more fluently and comprehends what they read, you have this, you know, more higher order area also involved. There's also these highways in the brain that basically enable these different brain areas to talk to each other. And what we know in dyslexia is that these brain areas work differently. So they're developing atypically, okay? So if you look at this like summary here, so there's various brain areas that research has shown that work differently and develop differently if a child is struggling with learning to read, okay? What's really important is, and we'll get to this, is that these brain differences can often be observed before this child starts their first day of kindergarten. And here's the important part, right? So if there's a struggling reader and we keep hearing, oh, he'll get it, just wait another year, he's just a little slower, oh, he's born in the summer, he's the youngest in his class, or you know, she is good at art, she will eventually catch up, or they're, you know, they just have to, you know, learn the language better and they will catch up. If it's really, you know, a difference in the brain, you know, waiting any day longer, any week longer, any months longer will just delay the child more and more, and will lead to these issues that we discussed earlier, that then they have less of a background knowledge, less vocabulary words, they have read less complex sentences, and it really affects, you know, then more than the English language arts. It can then affect reading, you know, word problems in math and understanding social studies, etc., etc. So what are the brain changes after remediation? And so what we know are that there's differences in the brain. So these are control children here, and these are children with dyslexia. And you can see here in the back that in this study, these children had less what we call activation. So that's basically the use of oxygen in the neurons compared to the control children. However, when they got intervention, and it doesn't matter what kind of intervention, what I'm trying to illustrate here is that the brain is very plastic. It can change a lot. It's almost like us going to the gym. And if we do this, then you can, through the right intervention, remediate or change this atypical brain development. And that also leads to, better reading outcomes. So when it comes to learning differences, and struggling readers learn differently, we are largely focused on reactive or deficit-driven or wait-to-fail model. What this means is usually we wait till a child shows up with a problem with learning to read, and then we're like, okay, we'll wait a little bit longer, or maybe we wait another year, or maybe we help a little bit, or maybe we should help a little bit more, and we wait and wait and wait, instead of like looking into prevention. So prevention is really common in medicine, where we're trying to catch a disease before it even developed, right? So you all probably got at one point maybe a check for high cholesterol, because we know it is a sign for heart disease. So if you have high cholesterol, it doesn't mean that you automatically develop heart disease, but what it means is that you have a higher risk to develop heart disease. And the same is the idea here, that we want to come to a point where we have preventive education, where we are trying to identify the children in kindergarten who will most likely struggle with learning to read. And we help them right then, so how we can lower cholesterol with more exercise or medicine, etc., so that eventually they will not develop problems with reading. And going back to my medicine example, someone will not develop problems with their heart. Or if they develop problems with reading, it's less severe. So right now we have this dyslexia paradox in a lot of our schools, where we usually wait till the end of second and beginning of third grade before we really diagnose someone with dyslexia and start intensive intervention. We can probably have many different stories tonight. People who telling us, oh, they just said I should wait, and I can't get an IEP in kindergarten. I'll just wait longer and wait longer. But what we do know is that the window for the most effective intervention, that doesn't mean that if intervention doesn't work later, but the window for the most effective intervention is in pre-K, in kindergarten, and first grade, okay? So, and the reason is that there's still a small gap between the struggling readers and the good readers. And we also know that the brain is a lot more plastic the younger a child is. So we can, make a lot more, bigger changes. So for instance, if you move to a different country before you're maybe 4 or 5, it's much easier to learn the language without an accent and without, having problems with grammar than when you're moving to a different country as an adult. So what are the early behavioral predictors of reading difficulties and dyslexia? So we talked about phonological awareness. We talked about pseudo-word repetition. So this is basically a memory for language. So what you do here is you give them a made-up word like body Kobe, and you ask the child to repeat the word. And so this is also a really good indicator if someone has verbal working memory and phonological memory. There's rapid automatized naming, which is a really good predictor of reading fluency. There's vocabulary. There's letter knowledge. Does the child know his or her letters? And can the child name the sound that the letter makes or the sound that goes with the letter? Okay, so the letter represents a sound. And oral listening comprehension is, do they understand complex sentences? Do they know how the end of a sentence is related to the beginning of a sentence? Okay, so as I said before, and this is all studies that showed this, is that the brain characteristics that we see in children with dyslexia often predate the onset of learning to read. So we should, you know, identify the little 5-year-olds with their backpacks, you know, before they start struggling, and not waiting, you know, if they struggle or not. And I have a starting kindergartner this year, so that's a really good example for me, my youngest. So one study we did in collaboration with MIT is we went into 21 partner schools in New England, and we screened 1,500 children. What we said to these school districts is, we come and for 30 minutes, we look at these early markers, and then we tell you who is at risk. And then we help you with professional development and see, you know, can we help these kids early so they will not struggle with learning to read? And so we got a lot of positive responses, but also we were very naive. A lot of school districts said, oh, no, we don't want you anywhere close to us, because if you identify children in kindergarten, we need to change. Our system then needs to move from 3rd grade, when we usually detect struggling readers, to kindergarten, and the parents will all be pressing on the younger ages, and we have to retrain teachers what to do and how to identify. And a lot of them, that's really sad, especially one I remember said, these kids will still struggle in 3rd and 4th and 5th grade. We can find them then, we don't have to find them early. Not thinking what this means for the mental health of these children, how sad they feel every day when all the other kids can do this and you just can't. You may be the fastest on the playground, but you just can't figure out how the sound relates to the letter because you learn differently. So we found 6 distinct cognitive profiles of early reading. And I'm not getting into detail here, but what I want to say is that we could find these profiles, so kids that showed early signs of struggling with learning to read even before they were instructed to learn to read, and then these remain stable over time. So how can we solve the dyslexia paradox? So we want to replace the wait to fail approach with a support model, right? So what we want to do is we want to do comprehensive early risk screening and evidence-based response to screening. And we have a law now in Massachusetts that says we need to identify children who are at risk for developing dyslexia as early as kindergarten. Okay, so that was really pushed through with the help of Decoding Dyslexia. So we want to do this early risk screening, but you know, it doesn't help if we just find out who will most likely struggle. We need to do something about it, right? Similar to, it doesn't help you if someone tells you you have high cholesterol. You want to make sure you're lowering this high cholesterol, right? So that there will be lower rates of dyslexia and reading disability because of the comprehensive early risk screening. Or if you still develop dyslexia, it will be less severe because you have gotten help and the right, you know, intervention early on. So what are some of the, you know, things we recommend? So screening should be short. It should be comprehensive, so it should include the language piece as well as this mechanic piece. If you think about my reading rope, it should be early. You shouldn't screen, later on. You should help kids and identify kids early. But if you want to do preventive education, you need to do it early. You need to include English language learners and children who speak dialect, especially African American dialect, who have an increased risk to struggle because it's almost like a second language. We want to make sure we have evidence-based response to screening. Another important part before I conclude is that there is a genetic component as well. So if there's an older sibling or a parent who were struggling with the mechanics of learning to read or have a dyslexia diagnosis, there's a 50% chance in the younger sibling or in the daughter or the son to also struggle. This is really high. That's 1 in 2, okay? It's much higher than some of the other developmental disabilities. There's also environmental risk factors for poor literacy outcomes that we should keep in mind. So, if you have stress related to trauma or uncertainty with your immigration status, if there's like poverty and, nutrition that may be, less optimal, or if there's, a less optimal learning environment or a caregiver with a substance abuse or chronic illness, these are also factors that have been shown to also affect the child. So we have to think as, these risk factors as well as, some protective factors, and that it's not just one thing like poor phonological awareness that causes dyslexia or causes problems with reading, that we need to look at the whole child and see what are some of these risk factors and what are some of the things that, may be protective that may help the child, like good vocabulary or, a high IQ, etc. Where should we screen? Hopefully in the schools, but we're also pushing to maybe screen in your pediatrician's office or in libraries. And so if we think about COVID-19, we also want to make sure that children who have been home for so many months now, that they are almost, they almost lost, as much as, 2 or 3 or 4 summers. And so it's really important that kids get, properly screened and properly assessed to see who, fell off the wagon when, and where are these kids actually, and how can we best support them, and what kinds of milestones, if you think about the different things important for learning to read, is this child missing, or may they have lost during this prolonged time being at home. And so we have some recommendations how educators can do assessments and screening over the computer. So we are helping a lot of school districts right now to assess and help them, like, how can we test children as young as kindergarten using their device they have at home and seeing, like, where are some of these signs. So the last 2 slides I have, one is on English language learners. And so for this slide, we're just focusing on Spanish because I had a slide here in this deck, but it's really important that, we are not just waiting in children who are English language learners, until the English is good enough to do English assessments. We want to make sure that they have proper, language, that they have that they understand the mechanics of mapping a sound of language onto a written counterpart. So you can screen them, and there are some, screening approaches, for instance, with non-words or other, instruments. And so to conclude, the development of reading proficiency is a public health issue. So we know that literacy is a widely recognized determinant of health outcome, and is associated with many indices of academic success, social success, success at the job, economic success. And the National Academy of Medicine even said that the duration of education, how many years a kid went to school, which is highly dependent on how well they read, is a better predictor of their long-term health and how long they live than whether they smoke cigarettes or whether they're obese or not. So it's really important. So we want to make sure that every child is learning to read with joy, because every child has the right to learn to read well. Thank you.
That is amazing, Dr. Gaab. I know that I heard of you so many times, and it's like every time it's always something new that I learn. And I want to just to let you guys know that we do have Christian Sullivan from BPS, from the district, that also here with us. And then now this is the questions. We're going to be able to take some questions before we bring the next panelist, Dr. Correa. So the first questions that I have, Dr. Gaab, is just let me say, like, will struggle writers component be addressed in a way that, on having someone being dyslexic, is the writers, what is the components? I know that you bring that slide, but if you can just kind of, elaborate a little bit more on that.
Yeah. So there is something also called dysgraphia, where kids have actually problems with writing, with the mechanics of writing, right? So, but it's similar to what we discussed in terms of reading. So you can have problems with the mechanics of writing, so that the letters are falling to one side, or you can't stay on the line, or you have problems holding the pen. But you can also have problems with writing because of the language piece, because you don't know how to construct a sentence, or you have a hard time reading what you just wrote. So there's so many different components. And so it's important to really look where exactly is the child struggling. And that is for so many of these developmental differences, right? The same with dyscalculia, with this like a math problem. So you want to make sure that you're breaking it down and not just saying like, oh my, this child is struggling with learning to read, so we'll just give, if there's enough struggle, we give them this one intervention, and if there's not enough struggle, we'll just keep them in the general classroom. No, it needs a little bit more refined, assessment and response to what they're struggling with.
The next one I saw that is someone who says, how do we as parents figure out if your child is struggling with reading in kindergarten?
Mm-hmm. Yeah, so there is a law now in Massachusetts that every child should be screened. And so if there is no screening happening in your school, you want to make sure you are asking, why is this not happening? There's also some ways. So we are currently developing a tool that I didn't introduce today because I didn't have the time, but that you may be able to do this in the home. But if you are, if you feel like that your child is struggling, you should talk to your teacher and make sure you get a nuanced response, not just, or she's fine, like ask the different components. Is her phonological awareness fine? What do you think about the language piece? Can she map the sounds of language onto the written counterparts? How about putting the sounds together and blending the sounds, decoding? that you know, often gives you a better idea than just asking, is my child doing fine? But there should be screening in every kindergarten classroom in Massachusetts.
Katrina, you want to take the next one?
I do. I just wanted to say thank you to Kirsten Sullivan for coming from BPS and answering questions in the Q&A. And she has to leave now to put her child to bed, but we really appreciate that you came and that you took in the presentation. So thank you.
I'm really sorry I have to leave right now, but that was a fabulous presentation. I really, really enjoyed it. Thank you so much for inviting me here tonight.
Thank you. Fabian, can you ask another question then?
Another question is, who can diagnose for dyslexia? What is the diagnosis process like? And what tests can be used to diagnose dyslexia?
Yeah, so there's various ways. So there is often a myth that only a medical professional can diagnose dyslexia, but that's not correct. So you can do this within an IEP process, so a school psychologist. You can go to a clinical psychologist or a neuropsychologist. It can be often also done by, you know, through a speech and language pathologist, because if you think about what are the milestones, especially early on, so there's now SLPs that have literacy training who can also identify these early things that we discussed. You can you know, go for instance to Boston Children's Hospital. You can do it within the school district. You can go to some of these centers, and a really good idea is to reach out to Decoding Dyslexia. So we work really closely with them. They can help you and point you in the right direction. But also the International Dyslexia Association has a Massachusetts branch. They at least used to have like a hotline that you could call, but I also heard just recently that they're also answering emails and making recommendations. There's a Facebook, I think, page for Decoding Dyslexia Massachusetts, where I often see parents really making good recommendations where to get diagnosis. Yeah, so there's various ways.
Okay, because I see I'm looking at the time, so I'll probably just take one more questions, and then after the presentation, so we'll be able to see where we can put more. And one question is like, that you're speaking to a group of parents here, that what advice do you have for us? And most of our children are older than that kindergarten age you mentioned. And are we too late? And one of the parents said that, you know, feel hopeless listening to you because they feel like, you know.
Yeah. No, you're definitely not, you know, too late, but, you know, at the same time, I would say, like, act right now. Don't, like, say, oh, I'm going to wait another year, or maybe, you know, he or she should just, you know, start the new school year, or maybe we'll just start in the new year. If your child is struggling, you want to, you know, start regardless of where they are, you know, get organized, ask fellow parents, you know, where to get help, advocate for your child. If they're behind and have not been assessed, ask for, you know, an assessment. Get, if you can, an outside evaluation. See, you know, what kind of supports you can give your child, and most importantly, support your child with their mental health. So we see so many kids struggle with, you know, anxiety and depression, and they think, oh, I'm I'm stupid and I can't do it, or, my friends think I'm lazy. It's really, really important that they see you as a unit behind them and someone who fights for them and supports their mental health, because especially in, COVID-19 times, this is a, very crucial aspect, so that we can make sure that they get help with their, reading, but also, maintain a healthy mental health system.
That is great. Thank you so much, Dr. Gaab. There is some few questions there, and then I'll probably just trying to go back and forth once Ms. Correa has come back, and then to share on that.
Yeah, and I will put in the chat an email address. So if you have any other questions, you can also always reach out to us. We have a 20-page resource package in the lab that has lots of local resources, like, offices we recommend, and evaluation centers we recommend, books, apps, homework help, etc. So I'm happy to send this to anyone who's interested, and if it's not hundreds, but we can try to answer every single email. It may not be right away tomorrow, but we'll definitely are dedicated to help you and support you in any way. I'm going to put this my email address in the chat.
That'll be great. And I think that someone was asking, like, they love your presentation. I want to give you that feedback. And if you're taking any more patients so they can do screening, or where can they go? But definitely we'll be able to get that package with you, and then we can put that on her website.
Yeah, and so there's one other thing is, so the National Center for Improving Literacy is a really, really great resource, as is the National Center for Learning Disabilities. I'll put these links in there in the chat as well. And the Florida Center for Reading Research has lots of very good resources for parents, what they can do at home if they have a struggling reader, especially in the younger ages.
Okay, great. Thank you.
Thank you, Nadine. That was a really wonderful presentation, very engaging.
Thank you.
I just want to say we have a lot of questions in the chat that aren't necessarily for Nadine, but are maybe for BPS or other people. We're going to try to get you answers to those questions, but we probably can't do it in this meeting now. But if you have a question in the Q&A, and it hasn't been answered, we will try to get that answered for you through BPS. So please keep those questions in there. It just might take a while, and keep an eye on our website. Thank you.
Great. Thank you. So now we're going to transition. So we saw the presentation from Dr. Gaab concerning about the whole brain of reading and in early dyslexia when a child is just presenting that. So it is my honor to have Ms. Correa, that has been with BPS special ed teacher for 17 years. And she's a certified Wilson teacher at the Elliott Innovative School, where she provides direct, small or large group instructions to address students' IEP goals and objective. She is part of the team that participate in planned professional development and problem solving. She works in different capacities. She mentors student residents, teachers by supporting lesson and behavior modification planning. Ms. Correa attended Northeastern University, where she received her transition for teaching program, as well as a master in special education and teaching. It is my great honor to have Ms. Correa with us tonight. So she's going to talk about rule-based reading, most likely what is Wilson rule-based, and how to apply that in the setting. So I know there's been few questions people are asking about the difference between OG and Wilson. Ms. Correa is not an OG certified, she is a Wilson certification. There's certain questions she may not be able to answer, but we'll do our best to make sure that her questions being answered. Ms. Correa, and you can share your screen.
Share my screen, but I can't turn on my video. It's not allowing me to, but I will share. Let's see if I can't even share my screen as well.
Yeah, you should be fine.
Am I able to do it now?
Yes.
It says host disabled.
Charlie, can you disable her so she can...
Ms. Correa, what are you signed on as? I can't find your name.
Correa.
So my name is Tara Correa, so maybe that might come up like that.
You'll see the logo TC
Yeah.
on the panelists.
I don't see me. Oh, I see you. You should be able to share your screen now.
Yes, I can. All right. Let me see if I can turn on my video. See my face. Can you see me? Hi. Yes. Sorry. So definitely I'm going to share, and I hope that I can clarify for parents what we normally do. Oops, sorry, I'm doing the wrong thing. So sorry. And I have to apologize, my computer's super slow too. So I've been doing Wilson, and I think this is my 6th year of doing Wilson reading system. And I just wanted to kind of give you what the system is designed for. So obviously this program is designed for students who struggle with decoding and encoding, students with dyslexia, students who are unable to decode accurately, slow readers who lack fluency, students who may know many words by sight, like they can memorize it, but have a very difficult reading new words if I present to them, and nonsense words, which are words that you need to know the actual sounds, students who often guess at words, students able to speak and understand English but not read or write it, poor spellers, students.
Excuse me, Ms. Correa?
Yes.
If I could just please ask you to slow down a little bit for our interpreters, that'd be great.
I'm sorry about that. Yes, I will. So students who are able to speak and understand English, but not able to read or write it. Poor spellers, that is something that always is one of the big cues, if that they're not able to spell specific words. That students who are unsuccessful with other reading programs, or who still have gaps in their decoding or spelling. So pretty much it's broken up, and I think I skipped a couple of things. Yes. So this is the structure of what we would normally do. The program follows a 10-part lesson plan that addresses decoding, encoding, fluency, vocabulary, and comprehension. And I kind of did a snapshot of specifically what I would normally look at when I'm physically writing a specific lesson for a student that I'm working with. Normally we break it up into those 3 parts. I'm going to go over the first part, which is word study. And this is emphasizing specifically on decoding. The student will have sound cards, and this includes a quick drill of the phonemes with teachers showing the sound cards, and we kind of go like A, apple, right? And that pretty much goes with longs. We normally start with vowels, so it would start with the long vowel sounds, and then the short vowel sounds, and then the long vowel sounds. Teacher will review concepts for reading, and during that time is whenever we're presenting a new skill. So I'm gonna pause and kind of push back a little bit. In Wilson, we're like a step thing, so a step system. So it would be, if a student is in sub-step 3, we will teach whatever is in that specific step 3 in the 0.5. So it's sub-step 3.1, we will teach that specific skill. And then students will have the second part of it, which is word cards. And this is where we do what we call the stack of cards, which is all of the sub-steps that we've taught so far. Students will continue to review those and see them so they can memorize and kind of practice those skills that we've already kind of gone through. The next part in the word part is the word list, and I call that the charting. This is where I can do a quick assessment of the things that I've taught already and kind of figure out where are the trouble spots and things that I need to go back and review. The last part of that is sentence reading, and students are then asked to kind of read words and kind of apply those same strategies that we've been working on with sound cards, with the tapping, with the word cards, and now doing it in sentences. And please tell me to slow down again if I'm going too fast. The next part is the spelling, and this is what we call encoding. And this, normally I would teach this separately on a different time frame. So I would give 30 or 45 minutes to give it more of a clearer understanding. The encoding is what I call reverse drills. So all of those skills that I've taught a student to kind of do when they are literally segmenting or tapping out sounds, I'm now asking them to do it the same way, but through a reverse drill. I'm asking them to tap out those sounds to help them specifically spell out those words. I will do that really quickly. I would kind of have a tile board. Students will kind of point. I will kind of identify the sound. Student will repeat the sound, point out to the letter. Same thing when it comes to just spelling out complete words. Students will tap out, point to the letters, and kind of do the same way that they would read the words, they would spell it.
Ms. Correa, could you please slow down?
Yes, I'm so sorry.
It's okay.
I am in speed. I will apologize. I've been on Zoom for a little bit, so it's like I'm in fast mode, but I will definitely slow down. So when we are doing the next part, so I want to repeat back. The spelling part is super, super important for students to already have mastered how to read the word, to kind of then do the reverse drill so that they can spell the words. We will do 3 parts in encoding. And the first one is the quick drill, which is the reverse drill. The seventh part will be teaching. That's when I would pause the students and I would slowly teach them if they need any reminders of how to stop and pause, scoop the letters, tap the sounds to kind of help them to kind of spell them out. Syllable cards are something that we use a lot, and that is when we get into multisyllabic words, and that means longer words. Students are taught to kind of break out those words so that they can identify the smaller parts, closed syllables, open syllables. There's a lot of language that goes through it, but we kind of teach that all through to the reading to kind of then support them in the encoding writing. The last part is dictation, and that's what I call the kids. I tell the kids that's the spelling test. And during that spelling test, students will be identifying sounds as well as real words, nonsense words, and also sight words, which we call them high frequency words. It can go back and forth, sight or high frequency words, words that you need to memorize. Students will also kind of, there's a section for sentence read, and students will listen to a sentence that I give them, repeat it back to them, write it back down, then break up each of the sentence structure, making sure that they are using their tapping sounds to read the words and also using their reverse drills to kind of spell out the words. The fluency part and comprehension is a smaller part of Wilson, but it's definitely a part that I slow down on because I do feel that transfer is super important. Students need to know that they are learning how to use all of these skills so that they can also use this when they are in science class, in social studies class, and all of the classes that language is very important for them to be successful. So here are only 2 steps to this part. And normally I usually do this in an actual 30-minute session. I will read, the first part of it, students will read a passage and it's a controlled text, meaning all of the words that they would get, all of the words that they would be reading are words that we have used and they have already have practice and they have used dictation and they've done all of those things. Students are then reading the passage, practicing all of the skills that they need in order to tap out sounds and read the words. I will then remove the books in front of them and they would have to kind of retell what they read in a sequential order. This kind of helps with visualizing. It also helps them with comprehension. The next part is listening comprehension. Normally I would read it and I will have students either sketch out what was happening and then I kind of remove that part from them as well and have them retell by steps. And this is a non-controlled passage. What that means is that there are words there that students will have to kind of slow down and use all the skills taught in the word study to be able to kind of understand and kind of practice and comprehend at the same time. So instruction. I know that a lot of people believe that Wilson can only be taught with just one-to-one instruction, But if you're very good and you're highly skilled, and there are actually classes that we take to kind of to have a group instruction, I normally enjoy having a group instruction of 3 to 5 students. One, they kind of support each other, and also when they're at older age, right, when they're middle school, and that's like the area that I'm teaching at, students love to kind of combine and support one another. And having that network, we obviously see them grow and become better readers because they feel like they have like a team, a support, and they know one another and they support one another. But definitely Wilson can be instructed one-to-one and also in a group setting. And that is all on my end. So if you guys want to ask questions, I can definitely try to answer them the best way I can.
Yes, thank you, Ms. Correa. I know that you are trying to drill a bit fast.
Sorry.
We'll just trying to just go back to the end questions and maybe probably just kind of repeat it.
Yep.
Someone who asks is like, is there a way you can give some kind of like a demonstration or like an example so they can understand what does that look like, so they can have a feeling what is their teachers is doing. And also the other question is, I don't think you can answer that, but I'm just putting it out there. Mm-hmm. The district BPS will be able to put OG versus Wilson. And thirdly, a parent put that my child received 2 times Wilson. Is that sufficient? Like, I think it's like 20 minutes or 30 minutes. Is that sufficient for the child?
I mean, what I can say is a lesson, naturally, I could do it. Natural lessons are either 30 to 45 minutes. And how I can go back on my screen and I can just show you specifically what I mean when I say that. Oops. This is so if you notice how it's broken up into 3 parts, right? The word study, the spelling, which I call encoding, and the fluency comprehension. We could normally do that, right? It is sufficient to say, I can break that up into 3 parts and say, I can do 30 minutes of word study. When we come back and see each other, we then practice it as an encoding. And then the next time I see you, we will definitely do some fluency and comprehension work. So 30 to 45 minutes is it's for me, will work when you're breaking it up into those categories. If that answered the question.
Another one is like, what is done with high school student with dyslexia?
So, I mean, that's a great question. And I can say that I have taught in the past high school students, and we've done the Wilson program. And I think the best thing about this system is that it is a step system. So students are like in a prescribed direct instruction with specifically, and they chart to move up. So we're always doing, so the word part of it, I am charting, I'm getting an assessment, and I can see if I'm moving on or if I am reteaching a certain part. And the same thing happens with encoding. I am doing dictation, which is a quick assessment to see if the students are able to apply whatever I taught them to kind of spell out those words.
Let's try to slow it down a little bit, Ms. Correa, because I know you're a little bit fast, because we can give the interpreter some time to translate that, because we have about like 7 interpreters.
I'm extremely sorry about that. I can definitely show something that I would do, like they said, demonstration of what it would look like. Is that what they kind of asked? Yes. I mean, I can say that it's very difficult to do it without a student, but
I have a student.
I would normally do, like if we're doing sound cards, these are the sound cards, right? And I would ask a student, all right, tell me, so it's like the student would be a, apple, and they would kind of like do that. And I think if she's getting the student, it must be Leah.
Yes.
Yeah. So definitely we can do the vowel sounds with Leah, and that would normally happen. Hi, Leah.
Hi.
You want to practice with me? You want to show them how we would do it?
Sure.
All right.
A, apple, A. O, octopus, A. E, ed, E. U, up, I, itch,
So notice I did not remind her, nor did I put it in a specific order. Is definitely you're supposed to kind of make sure anytime you do an actual Wilson lesson, you need to start with the vowels and definitely go through the short vowel sounds and the long vowel sounds. And then when they talked about the stack of like, when I kind of said students get familiar with the stack, I'm gonna put you to the test, Leah. So we do many different activities, and some of those activities might be timed, or we kind of try to make it as fun as possible so students can read them quickly. So normally we say you're gonna have a rainbow stack, so meaning you'll have some orange and some red, and that kind of just shows the different steps that we've been on. So we would try to do it as fast as we can.
Post.
Sorry.
Group.
All right, let's try that again. Let's tap it out.
Grump.
Good job.
Mess.
Can you say it again?
Niece.
All right, let's tap it out.
Mess.
Good job. So pretty much that. And then I'm going to give you one last one, Leah. How do we do this one?
Post.
Try it again.
Post.
All right, so I want you to now tap it out.
Pote. Pote.
With
Oat.
your fingers.
Oat. Pote. Pote.
Pot. Pot. And then if it's
Pot.
exactly. But once it has a suffix S, what do? We read
Suffix.
Yep, so we read the base word, then the suffix. Let's try it again.
Pot. Pot.
Perfect. And I'm putting you on the spot, so we'll stop. You did great, Faith.
Thank you, Ms. Correa. Thank you, Leah. So I just wanna go back to some of the questions. Somebody say, awesome job. Someone says, seeing how Wilson only has 2 steps for comprehension. If a student has a comprehension disability, will Wilson address comprehension disability?
And I would say that would be some other program will support the comprehension piece. Definitely we support it if students are still struggling with encoding and decoding, but if the student is reading fluently and is doing really well, we will definitely support with comprehension strategies, and definitely most of the curriculums are kind of helping out with those strategies to kind of build those comprehension skills.
Let's see, trying to just, because so many questions, I'm trying to just keep up with that. Someone is mentioning is like they are, I think that they're like, 5 or 4 questions about to look as the reader. Is a type of service assistant typically available with BPS? Is BPS will offer OG versus Wilson?
I don't know. That's a question I don't know. I am certified Wilson. I know friends that are certified OG. I mean, it's the same program, is made by the same people. It's just, I know more Wilson than what I do OG, but what I get out of it is that it's just, Wilson is more direct instruction and we're built on steps, right? You can't move from one step until you completed that and successfully understand that step.
How do we propose to help students catch up from not having proper support for many years?
I do feel Wilson supports reading instruction because it doesn't matter what grade you're in, it's going to put you specifically on the step that you need in order to build those reading skills. So I feel that I know that we are feeling the crunch for some friends that I was hearing that felt that, you know, they were overwhelmed because they felt like they missed the window. I do feel like all of the supports that we have kind of support students, and Wilson supports that reading skill, that readings, you know, building those reading muscle that the students might need. So it doesn't matter what grade they're in at this point, it's kind of getting them those services that they need.
Is it possible, Ms. Correa, you can explain the difference between Wilson and OG? Because the parents say that her daughter is getting Wilson at her school, I guess according to the IEP, but the tutor use OG. Is that gonna work?
I 100% believe that both program is made to support students that are struggling with encoding and decoding. So I 100% believe it is going to work.
Okay. Dr. Gaab, you're there?
Yes.
There's a questions here. See if you can give. I'll go back and forth. Can you give an example of tests that can be used to diagnose dyslexia more into it?
Yeah, so I've been answering, you know, at least 30 or 40 of the questions in the chat, so in the Q&A. So it's really important that you have a comprehensive battery. What I mean with this is, remember when I explained the different steps or milestones that go into reading? So if you just look at, for instance, single word reading, that will not tell you whether the child may have problems, you know, with reading fluency, or may have problems when you are asking to read words faster. If you're only testing phonological awareness and maybe only testing first sound, you know, identification, you don't know whether there's maybe a problem with phonological memory, or maybe if rapid automatized naming is, you know, affected in addition to phonological processing. So it's really important to have a comprehensive battery, and that it's a standardized assessment battery. So it shouldn't be any tests that the teacher developed themselves or that someone made up. It should be something that's normed and has proper validity and reliability. So there's you know, a good section on this on the National Center for Improving Literacy's website.
Okay. Okay. I'm just going back and forth on that. How do you learn what the appropriate intervention is? Meaning how much time and often? I know that you say that about it, Ms. Correa, but I know some students, it depends on the age that they get into the IEP. For instance, like if a child, they didn't get diagnosis until like middle school. So versus we're used to have like 3 times Wilson. So now you really have to drill to spend more time in that. Can you just kind of explain to the parents what does look like and what can recommendation of putting in the IEP for?
Yeah, I can share that it depends on the student's need, that we kind of look at how many times a week we will do it. There are students that probably might need support in spelling, so that will kind of represent in their IEP that they're still kind of struggling with encoding. So definitely if a student has, is struggling with reading fluency, reading or decoding or encoding, and they're at like the beginning stages, normally we do a WADE test, and that's what Wilson would do to see what sub-step they will fall under. And there we can kind of sit down and have a conversation of what will be the amount of time that student might need. But if a student is beginning early on, I don't want to give a number, but I notice that normally what I would see on an IEP is the student will have it every day, right? So 5 times 30 or 5 times 45 is what I would normally see on an IEP of a student that is struggling.
Another one, I'm just looking at the time, probably like, well, now we're down. And just to let people know, if the question hasn't been answered, so we're gonna try to do our best to just get those answered for you, and then we'll be able to share that. What is the criteria BPS used to determine if a child has a reading-based SLD and is eligible for Wilson OG individual services delivery?
Is that for me to answer?
Yes.
So, I mean, I can only go back to students if they're in the first planning stages, they definitely get an evaluation where they get a psych eval and they kind of get the academic testing. And then from there is where the IEP is generated. And normally every 3 years, students that are on IEPs get academic testing to see how they're doing and how they're meeting their goals and if they still continue to need the services. So I do feel like that must be the same techniques, or whatever I should say, the same testing that happens for any student that is on an IEP or are suspected to be needing an IEP.
I'm not sure if you know this question, this answer. Someone mentioned it's like all Wilson reading teachers in BPS are level 1 certified.
Are they all? Oh, I don't know.
Yes.
I think what I know for myself is that I did get certified for level 1, and then after, you know, becoming really strong at what I was doing, then I decided to get this level 2 certification.
Just to also to clarify, there is level 1 that probably a lot of the teachers in BPS, that's what I have, but also in the past, BPS used to have the weekend certification, and then that's where a lot of the teachers used to get that. But being certified with Wilson is a 2 years program, and Miss Correa can elaborate on that. It's a 2 years long practicing and workshop program that you have to do and then practicing it. So that's a difference between a weekend certification versus the whole structures of the 2 years plus program.
Yeah, so Wilson certification is kind of like just getting a teacher's degree again. So you have a practicum and you have a coach that comes and supports you, and you just have to pass all of these. We have to kind of like teach a student in front of our coach before we get the certification. So it's definitely a much longer process than the 3-week. And I feel like the 3-week is more of like a crash course for teachers that are already certified. I don't think that when you do the 3-day one, you're considered a certified Wilson teacher.
Yes, true, but believe it or not, there's some teachers through the district saying that they are Wilson, and that's what they got. And to looking at the time, I just want to probably for Dr. Gaab is, believe someone is putting the questions concerning about autism.
Fabienne, we should also put up our poll.
Oh yes, let me just get the last one and then we'll put the poll in that.
Okay.
How do we easily recognize this is in a child with autism diagnosis? Like if a child is diagnosed with, is autistic, and will they be able to be dyslexic at the same time?
Yeah, this is really tricky. I mean, there is a lot of comorbidities between dyslexia. So there's about, 40% overlap with the ADHD. There's a strong overlap with dyscalculia. There's some overlap with the autism spectrum. I would recommend that you go to a place where they're familiar with comorbidities. So for instance, Developmental Medicine Center at Boston Children's Hospital is really specialized in kids who have like a, multiple problems, to tease apart which one is causing what and what is the best strategy. So I think it definitely can be done, but it's hard to answer because I don't know the specific case and if the language level of the child, etc. So.
Okay, great. We just want to put a poll there, and then just to get everybody's feedback. And I want to say thank you to Dr. Gaab and as well Ms. Correa for doing the presentation. And it was so very well formative to parents to get that knowledge. We've been busy answering a lot of questions in the chat and as well in the Q&A, and we'll be able to share once we get the package from Dr. Gaab. We'll be able to share it with the families. Katrina, I think Charlie, you can put the polls in there.
Fabian, will you thank Leah from us?
Yes, we'll definitely thank Leah for that. Thank you. Sandy, do you, Katrina, who has the poll?
Sorry,
Hey,
Fabian.
Charlie, is it you or me? Can you put the poll up? There we go. Yay.
Can everybody see the poll in progress? Okay.
Yeah, that's good. Well, so we can pass that on when we're discussing this topic and the poll results. And I think when we've wrapped this up, we've got 75. Oh, look at that. Yeah, well, that is pretty discouraging.
Right.
And I think Dr. Gaab touched on this earlier, and I'm sure Ms. Correa also sees that kind of thing. So thank you all very much, and thank you to the audience for all the terrific questions and participating in the poll, and I hope you'll let us know how you think it went. And we're always here. You can reach us on Facebook or by email. We have a phone number. Our contact information is easy to find. And we're always happy to hear from parents and to have you join us.
I want to say thank you to all the parents, all the panelists, and the staff of SpEdPAC, and for just working so hard and to help the students and the families. Especially reading is like, the grassroots of the educations, and as well to make sure that, what will be the next step, because if you cannot read, there's so many different things it affects, like not only social, emotional, but mental health, and your jobs and capability of doing anything. So that is a huge, and just to let you know, October is Dyslexia Awareness month, and starting with October 1st, we start kicking in until the 30th. There's so many different events, so many different activities that will be taking place, and we're gonna put the Zakim Bridge red on lighting red in October 15. We usually have an event under the bridge, and unfortunately because of COVID, we'll not have that, but we'll be able to just have the bridge red. We have an event that's gonna take place on October 25th with Dr. Dyslexia Dode, and I will definitely share the flyer and then also in social media the event, so we can be able to just let family knows that, you know, you're not in this by yourself. We there to support you and help and guide, or just to make sure to tap where we can share the resources with you. Follow us on Decoding Dyslexia Facebook, Massachusetts, and also visit our website. And I'm looking forward to continue working with you guys for the next year as a board member. And I want to say thank you again to everyone. Charlie, you want to take it away?
Thank you for your evening. Really appreciated.
Much, and have a wonderful evening. Thank you, Ms. Thank you, Dr.
Me.
Thank you, Fabienne.
You're welcome.